Dr. Frank Song. Thank you for being here.
Thank
Um,
you for having me.
yes, Dr. Song works in Connecticut and Vermont, and he specializes in Lyme disease. Do you have other specialties as well that you really enjoy working with?
Lyme, tick-borne diseases, and chronic complex illnesses, just because once you get like the post-treatment Lyme syndrome, chronic Lyme patients, there's often other things that are co-occurring in the chronic illness kind of sphere. So that includes mold toxicity, that includes other autoimmune diseases, that includes, stepping into the mind-body realm of like how our traumas inform sometimes our conditions, things like that. So
Which I hope we will get into a little bit.
Mhm,
Oh,
mhm. Yeah. Hopefully with
different.
we're gonna kind of go through the Lyme piece. So I've kind of curated knowledge that's really specific to the Lyme and tick-borne disease population and how to explore the mind bodies or like not I'm not giving any instructions on how to. It's just more so what I've seen. I've culminated essentially my years of experience into things that have been helpful for patients. Yeah.
Awesome. Perfect. Well, I'm really looking forward to it. Um, what are some other fun facts about you before we get started, just to kind of keep it light?
Yeah, I have like a whole little like introduction thing too, so I'll just quickly go through those. But fun things. The most fun thing is for me it's maybe not as fun right now, but I'm pursuing my professional music career right now. So I'm a musician in Brooklyn, New York City, and I'm just playing music and trying to also chase that dream at the same time. I finished out the residency, the doctor kind of piece, kind of am sailing with my practice and trying to cruise control on that while actually like working towards something that I've always dreamed of doing. And I think that music is such a powerful tool in healing and arts in general, art therapy. So that's something fun about me. I love being outside. I love my friends. I'm a
Yeah, no, I think
Pisces.
that's
I don't know.
no, that's so important. I was really hoping you would talk about the music piece because yeah, it's a part of, and again, I'm sure we'll get into this later, but it's a part of the whole healing conversation. Like not
Yes,
just
yes.
focusing on chasing cures and treatments and doing the work, but enjoying your life.
Yeah, yeah. And I always encourage art with my patients because of just my own personal experience with art. It's where I put all my stories. It always brings me relief. It brings me a way to interface with my own self and subconsciousness and also put the trauma somewhere. And music, actually performing the music isn't any different than poetry or lyrical writing or journaling. Oftentimes, songwriters, I work with a lot of songwriters, and we always talk about how a songwriting session is like therapy. You just talk about what's going on within you, and then you put that into a song. But then that's no different than taking your journal entries and just being like, let's look at, the pain from this experience felt like fire, and then that becomes a lyric and that reminds you of that's a way to just connect with that experience. And if you perform, it can be a somatic experience to actually release the tension rather than swallowing it, which gets into like other forms of healing. If you think about like the throat chakra and expressing out so you're not holding within yourself and swallowing and suppressing your emotions, either mentally or physically. Yeah.
Yeah, absolutely. Thank you for sharing all that.
Of
Yeah,
course.
let's go ahead and get
Let's
started.
get
Yeah.
started. Okay. I'm going to pull up this. So I made this presentation for a support group that I was presented at up in Vermont at a physical therapy practice, but I named it Lyme, tick-borne disease, and chronic illness, the bigger picture, mind-body connection, and wisdoms for patients. So it's true. It's right in the name. I basically wanted to talk about the big picture of Lyme and tick-borne diseases. The reason why I want to talk about the bigger picture is because there can be a lot of self-blame when it comes to chronic illness. It's like, what's wrong with me? Why is my body this way? Like, what did I do wrong to deserve this? Those are very common things that come up. And I like to talk about the bigger picture because maybe the blame isn't all on individual, the patient. Maybe we are all just canaries in the coal mine responding to the environment, the climate change, the real pressures of being in our society that lead to an environment it becomes very easy to acquire a chronic illness in our today's world, in my opinion. Mind body connection, I think that our system of medicine that we work in really like to keep them separate. But when you're working with Lyme and tick-borne diseases, chronic infections, I think it's important to bring up the mind body connection, and then some little wisdoms and pearls that I have acquired along the way, having the privilege of working with patients. I always have had a very, I try to be, I'm very cognizant and have a lot of humility when it comes to my training, in the sense that I would not be learning any of the things I've learned today if it wasn't because of the vulnerability of my patients to trust their care in me. So hopefully what it feels like on my end is I'm taking all of these lessons from other people in the community that are going through the same conditions as you all are, or working through. And these are the things that have helped them. And they've shared these wisdoms wherever they are along their healing journey. And I'm able to bring this and be like, hey, if you're here in this journey, this is what someone told me really helps with them. Because I have a lot of sympathy for this, but I personally have not gone through Lyme and tick-borne diseases. In terms of my own body, I got into this at the same time. Also, a family member was going through this as well, so I have that familial relationship. But other than that, this is mostly sympathy and me just trying to be as supportive as I can as an ally and a clinician in this field. So, really quickly, just educational background in case you're interested. University of Virginia, did my bachelor's. I doubled in anthropology and biology. University of Bridgeport is where I got my doctorate in naturopathic medicine and master's in human nutrition. And then my residencies where I did my Lyme and tick-borne disease training with Dr. Alexis Chesney. I worked in a primary care facility, so I did a lot of triaging, antibiotics and herbal approaches, orthomoleculars, et cetera, et cetera. And I'm affiliated with the International Lyme and Associated Diseases Society. I'm also a member of the International Society on Environmentally Acquired Illnesses. So the ICI, the International Society on Environmentally Acquired Illnesses, has a lot of crossover with ILADS, but they encompass mold toxicity, heavy metal toxicity, things like that. So oftentimes we have to explore those in specific cases. A lot of the Lyme, MCAS, POTS kind of uh, constellation kind of cases, you want to start exploring environmentally acquired illnesses. And so ICI has a lot of great conferences. I believe that they have really great training. I got into this because my mentor was a part of both of these organizations too, and I really, really respect her work and her objective assessments of quality of care. So I do think that finding practitioners through these organizations is puts you ahead of just like, the general training kind of ground. So just did some zooming ins on those. Speaking engagements, I haven't updated this presentation since, but I present at the International Congress on Naturopathic Medicine. I was the keynote speaker at the Connecticut Naturopathic Physicians Association. And I do community and public health presentations like this one. I also have experiences as a mental health care worker at the Brattleboro, Vermont, Brattleboro Retreat Psychiatric Hospital. I did the children's residential psych care, and I'm a New York City based professional musician. And I do music in the Asian folk music, American folk music realm. I was raised in Virginia, so in the Blue Ridge Appalachia region. So I did fiddling, I did Celtic music, all that stuff. R&B and soul is another one of my passions. And these are just pictures of my white coat ceremony. That was the clinic in Vermont. And that's the Virginia Bluebell, because I was a Virginia Bluebell up in Vermont. And then that's me doing my music things. I like to kind of always break the third wall. I think it's important that when you're working with a practitioner that you feel like they're a human being as well. And I think it rounds out my work as well. It allows me to just have more humility in my work and for my patients to see me as a human. And I try to break down some of the structures we have in the conventional medical world system, which is, oh, it's a white coat, it's an unattainable pedestaled figure. It's like, no, I'm a real human being who's going through suffering and going through my own things as well. And so hopefully that, of course, the boundaries are still up, but it creates a setting where I feel, we're on the same playing field and we're working on this together. So that's why there's this as well. So disclaimer, I always like to put in that not every topic in this presentation is applicable to every patient on their journey with Lyme and tick-borne diseases. This is a huge area of pathology. And when you have different co-infections, comorbidities, statuses, different family values, financial, brackets, all these things, it really orients each individual to a different path, in my opinion. And I think that by giving each patient a specific individualized treatment outcome or treatment protocol that's rooted in research, that's the best way to treat someone. And also, there are different people coming in at different places in their lives in terms of I've had chronic, like Lyme disease or chronic condition, this chronic condition for 8 years versus I'm more acute and I'm a year in, and et cetera, et cetera. I'm not affiliated or sponsored by any nutraceutical companies. I currently practice at Placeris Integrative Medicine in New Milford, Connecticut. I see patients remotely in Connecticut and Vermont. Um, I have in-person options with flexibility as well. So this is where we get into the actual. This is where I want to talk about fast facts, big picture, to let people know that this is not your fault. We are all just experiencing the outcomes of the world. So Lyme disease incidence. So I do believe I do a zoom in on there. So this is the increase of the number of CDC reported cases and the CDC estimated total diagnosed cases. So as you can see, it's approaching 500,000 per year, and it's been steadily increasing over the years. So this
Is
is just the fact. Sorry.
can I ask, yeah, Dr. Song, is this because we have different testing, or is this the same testing showing a true
Yeah.
increase?
So I think it's both. I think the prevalence is increasing. The case reporting is increasing. Primary care has been informed to do more case reports. And so it's a combination of the fact that we are realizing it's a problem, so we're reporting them more. And also the incidence is going up of the number of cases due to the tick population, the white-footed mice population, climate change as well. So as you can see, I talk about climate change, right? Up here in the Northeast, down in the South, it's a little bit less obvious, I would say, but it's still happening because temperatures are increasing. Cold is not as prevalent. Migration, things are migrating to the areas more, et cetera, et cetera. But heat, humidity, precipitation impacts on small mammal populations. So the more we impact hawk populations, owl populations. So the reason why this is important is because Lyme and tick-borne diseases aren't inherently birthed into the population of ticks. They have to first acquire it from a host. So white-footed mice, excuse me, are where we acquire it. And then it bites that first, acquires the blood from the mice, and then it bites us and it transfers over Lyme disease, Babesia, Rocky Mountain spotted fever, et cetera, et cetera, et cetera. So when we're working with Lyme and tick-borne disease, we actually have to work with the ecology as well. So that is why, due to the ecology around you, you may be more susceptible because of housing developments, forests, you know, ticks favor the transition zone between field and forest. So when those things are happening with land development, you get these more favorable populations or more favorable ecology. Speciation, all that stuff. American Western culture. So when we're talking about work-life balance, social support, mental health, illness stigma, community-oriented society, food, chemicals, building practices, animal husbandry, agricultural, media, social media, rhetoric, I think all of those things create an environment for chronic illness. Like in my clinical practice, oftentimes the patients I end up working with are patients who have had a history of chronic stress. Single mothers really end up in my practice, elderly who are alone, don't have much support system, who still have to support themselves, find themselves in their practice because their bodies are in a more favorable environment for chronic illness. And so all of these things, are interconnected with why I think we're seeing more autoimmune disease, why we're seeing more chronic illness and chronic stress and depression and anxiety, medical. And so we're combining the American and Western cultural components that are causing chronic illness, the 9 to 5, the body image, all these things. And then you're combining it with the medical model and their shortcomings, right? Private insurance, consumerism, antibiotic only approach, antibiotic resistance, co-infections and comorbidities, antiquated standardized testing, prophylaxis care models, palliation, and a preference for palliation versus cure. So we're just trying to manage the symptoms of Lyme versus trying to actually address the Lyme disease itself. Or we don't feel like we have the tools outside of antibiotics to do that work. So I am saying all of these big concepts to say, now think about you as an individual, you as a body caught in between all of this. Like, is the blame all on you as a patient suffering from this? Or is some of it due to the external environment, the literal natural environment, but now the socio-cultural and medically anthropological environment that's surrounding you, that's not giving you the right resources to heal. So as a practitioner, I want to take some of the blame away from patients, especially the patients who feel like they have to constantly be advocating for themselves or constantly be like putting the pressure on themselves. I want to say, like, I'm sorry that you feel like you have to do this on your own. And I, as a practitioner, see how many cracks there are in our society and in our medical model that have left a lot of patients feeling helpless if they're not helping themselves, basically. So I want to communicate that message. I hope that it validates people. So in the mind, body, and mental health realm, as a naturopathic physician, I see people coming in trying all different kinds of things, right? They're like, is there a mind body connection? Yes, I believe that working from that space is important for Lyme and tick-borne diseases. So we can go into the concept. We're going to go into some of this. I'm going to just, quick shot the stuff that has been helpful for my patients, and then some of the pearls and aphorisms that have been supportive to my patients. But working with a therapist, counselor, mental health support, community support, can help support behavioral changes, discussing adaptive and maladaptive coping mechanisms, and a safe space to talk about illness. So really the levels are when you're going through this treatment, it can be a lot. I feel that someone should be there either on the community level, familial level, and or a professional level to help support patients through all the changes, the mental exhaustion, the ability to step outside, maybe into a third space to look at the journey they're taking, because suffering can be very like heads down to the ground, charge forward, moving forward. That there needs to be some time of reflection and time of gratitude or just reflection and someone holding up the mirror, and reducing the stress and anxiety and depression during chronic illness treatment can be extremely important.
Also, yeah, I just want to add in there, most people kind of have this idea that mental health support or working on your mental side when you're treating chronic illness is like, "Oh, if I treat my trauma, like, this will go away," and it's not cut like that. And so
Yeah.
that's what you're speaking to here, but just kind of reiterating from the language that I hear from clients a lot and even online and comment threads, it's like, "Oh, heal my trauma." I'll see people kind of comment things like, "I've been in therapy for X amount of years, it hasn't touched, this thing." And it's like, it's such a whole that's like one, it's only one part, one small part.
Mm.
And then two, healing trauma doesn't necessarily cure a physical disease.
Right.
It can make changes in the body for sure, but yeah, it's really a nuanced conversation.
It's a nuanced conversation. It's leveled, and I think the power comes when we actually integrate it all, right? I was going to say the word integration because you can do the trauma work, but then the integration and the realization of how it manifests in your behaviors, and then making the changes around that are so difficult. Can be difficult. Aren't very difficult, but our interpersonal relationship gets locked into our patterns, our food, our way we live our lives, our jobs we get into get locked in. And then on top of that, when you have a chronic illness and you're 10 years into it, sometimes you've oriented your life around the chronic illness. So stepping out of that space can be filled with fear and anxiety. Like, what if I go do this again and it causes me to have a 2 to 3 day flare up? And am I ready to do that? Is there someone I can have a conversation with that can say, "Hey, why don't you try 20% of this and then let's see how you feel." And having someone to work through that with makes the journey less like black and white, go or stop. And so that's why I encourage having a practitioner who's trained in counseling be with patients as they make these changes, as they journey into maybe a new normal in their life and unpack maybe what the old normal. I was just on the radio with Dr. Katie Pearson in Bridgeport, and we were talking about with patients, we have to sometimes we bring up conversations about what about before maybe was unhealthy and where are we moving towards now that's a new normal. And so that's something that can be a hard conversation because we have our attachments to what was, and having a space that feels safe and loving, that's not triggering to explore that can be very, very powerful and can be from a space of just love and support rather than getting into other emotions that can block us from getting to those realizations. I always break up my presentations with little images because a biochemistry professor of mine said that our attention spans are only about 15 minutes at a time. So this is a picture from my farm in Virginia. These were two butterflies that were just dancing on some thistles. And in my culture, the souls of your ancestors visit you on the wings of butterflies. So whenever you see a butterfly flying by, just like think about the people who have passed, who love you and are there to still like watch you thrive and grow.
That's beautiful.
Yeah. So what works for me works for me. So this is something big at this time. So these are all very nuanced, but when I work in chronic Lyme care, and especially being a naturopathic doctor as well, you get people coming in with all kinds of other modalities they're working with. And I keep a very open mind. So if it's working for you, let's assess how is and why is it working for you. The thing I can offer you is not telling you yes or no, but how is this helping you? And I can tell you as a practitioner, do I think that will be helpful in your chronic illness care? Right? If you're getting into ayahuasca in Brooklyn and all you're doing is doing ayahuasca every other week and it's actually causing you to dissociate from your problems and stepping out from the reality, then I would tell you that. But if you're doing an entheogenic plant medicine and it's helping you dive into physical trauma you've been through in the past, something huge that you've never actually unpacked before, then I think that's beautiful. Now let's talk about what other care that you can get into to help integrate those realizations, right? So, people come in, I'm doing CBT, I'm doing DBT, I'm doing ACT therapy, entheogenic, I'm doing shamanic arts, I'm doing classical psychology, MDR. All of these things can work. And I just say, always keep an open mind and offer suggestions of at this time, it's helping you. Now what's next, right? So, and trusting the dialogue that I'm having with a patient, being like, okay, I've done a lot of talk therapy. I know I have this trauma, but I still feel it in my body. Hey, is it time to explore a more somatic based therapy? Are we talking somatic experiencing? Are we talking TRE? We're talking Alexander, technique. All of these different tools, and then working with a practitioner who's informed on these different techniques or tools. And that doesn't have to mean a doctor, but someone that you trust that feels like they've have a grounded understanding and no bias around these things to be like, hey, a somatic experiencing type therapy might be good for you because you may still have the somatic stored trauma and your physical body is being the cortisol patterns are being triggered even though you cognitively know and you created in a different environment, but you still have to get in your car and drive and you still have to interact with the public. Let's talk about where you feel it in your body and what seizes up and what kind of maybe stress hormone profile is or neurotransmitter profile is being shaped around your physical and mental experiences. That might be the next step in the healing, right? So I'm always open to, and I think treating Lyme and chronic illness takes a team. I think it would be very egotistical to think that like, oh, you come into my office and Dr. Frank Song can help you with everything. No, that is not how this is how I think the most effective care. Someone should be taking care of the physical body, working with the PT, working with, chiro, working with in Vermont, I had Lyme disease and tick-borne disease focused PTs. So they would be working on the detox side. They would be working on water aerobic therapy for the joints, like oriented towards this specific condition. So a team-based approach is absolutely everything. And I have seen it help my patients much better than working with one individual who's just giving one antibiotic.
I think that brings us back to that kind of community approach. And also, even in kind of relationship therapy, one of the biggest concepts we work on is one person can't be your everything in
Right.
romantic relationships, in even parental child relationships, and in the doctor patient relationships.
Totally. And I think the world of Lyme and tick-borne diseases, because there's such a stigma around it, you go to your doctor and they might say like, oh, it's in your head. It becomes much harder to share with your friends what's going on because somebody of an authoritative positioning in our society has told you that it's not real. or you reading on the internet and it's so much misinformation and so much back and forth, and there's both people like there might be people who are saying, "Yes, I have it," who also rub you the wrong way. You're like, "I don't I feel like I'm different than you." But, so having a community and being able to talk openly with your friends about it, having a support group of people who are going through this condition with guidance from a clinician, I think that that is important and empowering and is bringing to the forefront something that needs to be talked about in society. Like, there's so much stigma around this. I want to ask the greater society too. Like, we used to stigmatize depression, anxiety, and suicide, and all these things, even though they've been real. Like, are we doing the same thing with chronic illness because it's scary? And we stigmatize cancer, even. This brings me to the next I trained with Dr. Joseph Trunzo, who is a clinical psychologist. He started his work in as a clinical psychologist, specifically studying therapy with cancer patients. He was saying one of his pearls to me was with cancer, it's a visible disease. Once someone starts going through radiation and chemotherapy, they look sickly, so they can garner. I hate to say garner, but they're able to get the sympathy and get the understanding because it's visible. But with conditions like Lyme disease, or let's not even talk about Lyme, let's talk about autoimmune diseases like Hashimoto's and, we're talking ulcerative colitis, we're talking Crohn's disease, something invisible where it's just you alone suffering in your bathroom, or you alone at night in pain. People can't see it. So it's not like, oh, poor you looking sick. It's
And
harder to
God
talk about.
forbid you're sick and have extra weight on your body, and then it's
Right.
your fault for being overweight. Yeah.
Correct. Correct. We start losing our sympathy in a way, or it just doesn't hit us in that visual kind of way. And oftentimes, as human creatures in our society, we're very visually run, and we don't, feel the depth in people as much. It can be, and which is sometimes good. That's kind of tangential, so we're not going to go there. But Living Beyond Lyme is a book I do recommend to a lot of my patients going through chronic illness. It's based in therapy, so that's acceptance commitment therapy. You can go on Psychology Today and you can find practitioners who are trained in ACT therapy. But I pull a lot of, I don't do any kind of diagnosing of mental illnesses, but I do bring in counseling technique in my practice. And I pull a lot from my training with Dr. Trunzo. So that's ACT therapy. So this book is great. It has firsthand accounts from patients who are going through Lyme and tick-borne diseases. It talks about how he's utilized these techniques, and then the patient reporting how this technique has allowed the integration of different behaviors that have helped them with their. It doesn't cure the illness, but it helps them along the journey, and maybe is a big uh, a tool in their toolkit to help them reach recovery and whatever that means for them.
I wanted to
So
add, also, you in your last slide, you kind of mentioned these different types of treatments and trying what works for you right now. And one of the things that sometimes comes up in my work with medical trauma is having tried so many different things that quote don't work. And
Mhm.
on one hand, that's absolutely true, but for people listening, just keep in mind that this all is a journey, and nobody has an exact answer for you to say this is the exact. Even with cancer treatment and chemotherapy, there is no 100% chance that this is exactly what's going to help. We have data around certain diseases that have higher likelihood of this thing working over this thing, yes, but it's still a journey. And when we think about it and kind of reframe our journey as we're in this next part, and how do I enjoy my life and do what makes my life meaningful in each chapter, whether your chapter now includes chiropractic or acupuncture or antibiotics or all of these different treatments. If you think about it as this thing must work and I'm only doing it to for this thing to work to get rid of the illness, then you're setting yourself up for failure almost every time. So
Right.
that exacerbates the trauma response that can happen to something, quote, "not working." So
Absolutely.
that's very nuanced because you can engage in some things that were harmful for sure. Even
Absolutely.
surgery can be unnecessary, or an antibiotic, or maybe you spent thousands of dollars on acupuncture and it wasn't what you needed. So that can be traumatic. This is me.
Absolutely.
But
Absolutely. And that is why I'm very sensitive to this. And that's why I put that disclaimer at the beginning, because it truly is when we sit down, it's like, where have you been? What is your journey? What are you comfortable with? And making sure that I do the job on the clinical diagnosis side to make sure that we actually are orienting the patient correctly to the treatments and putting them through as little medical trauma as possible. Yes, a lot of individuals who walk in through my door who are patients have already had so much medical trauma. They're 6 to 8 months of antibiotics, and the antibiotic was treating one thing when really they have a co-infection that needs to be treated with other antibiotics. But then having that conversation and making sure a patient feels safe to try again is hard. I see patients, when I see someone walking in through my door, I already know that at least they haven't given up on looking and trying to heal, because it is so easy to give up. And I've seen patients give up and then look to other means to just manage their pain and their suffering, or being like, this is it, this is just life. So um I have a lot of heart and sympathy to that. So, like I said, I trained mostly in the ACT therapy that Dr. Trunzo provides, and I combined it with I have a holistic counseling, a naturopathic medical holistic counseling oriented counseling certification. It's called Beast Dialogue, but it's considered holistic counseling. So I combine that and then some of my mental health care work to kind of inform how I support patients through. But I wanted to share kind of a concept from ACT therapy, which is the value system identification, which has been so helpful to my patients with chronic illness, because it is so I can empathize when things happen in life. You can't do this anymore. I used to love this, but it's too painful now. I've lost it. I won't be able to do this again. I've lost hope. I've lost hope in this because I lost the thing I love to do. I can't be the best mother, the best friend, the best athlete, et cetera, et cetera. So that is something very common with chronic illness, because of your pain, because of your fatigue, because of how things trigger your symptoms, you start the things you identify with, the things that you value in your life might feel like they're ripped away from you. And so ACT therapy can be very helpful, because one concept is identifying why you value it, or what about this activity do you value? So questions I would ask is, what did you love about the thing you lost? What was the value behind that for you? How do you engage in that value again that can bring you the same joy, fulfillment, or excitement? So that may look like, hey, like, I can't be the best mother anymore. Well, what about being a mother do you value? I value being able to enrich my kid's life with activities, and I can't do that anymore by biking with them and taking them. Okay, what else could you do? Well, I could be crafting at home. I could be enriching them through this or that and spending that quality time. So we reorient, and it may sound a little bit on the nose and cliche. However, when you are in that state, sometimes it becomes it can be very dramatic in terms of our responses to them. And my goal is to help someone feel like they're still engaging with activity. Oh, I can't do this sport anymore. Why did you love this sport? The team aspect. Oh, are there other team-oriented activities that you do that can bring you that same feeling of community? Because that's why you loved it, you know? So really identifying the value, and then why you do that this is just like I kind of like made a fake dialogue. Oh, going to the beach, da da da. Why do I value it? Well, I want to be able to plan and do activities for them. It feels like I'm not providing the childhood that I had envisioned for them. That is totally understandable. What else, or how else could you engage with this that is within your capabilities? Well, I have been meaning to do more board games with them, or et cetera, especially now that they're older. So it's like, oh, let's try and do that. Try that out. Like, you can do that within the capabilities of your chronic illness and your recovery. And I said, sometimes we lose something we value. We often try to do more outside of our wheelhouse, furthering our illness to compensate, or sometimes we completely detach and get stuck in the shame cycle and failure cycle, or no worth cycle. And that simply is not true. We can step beyond that. So this is, again, not something that might be specific to you, but just an example of how something like ACT therapy can support someone through chronic illness, is helping someone adapt. What I believe there was a study that came out. Oh, let's break for a second. This is a highly poisonous salamander. It secretes a mucus that can kill like 40 to 70 humans.
Oh my God.
And it's so cute. And it's used in biological studies to study the red queen phenomenon, which is in a closed island system. There are these snakes that feed on them. And what would happen would be that all the snakes that didn't have the antivenom would die, and the ones with with larger amounts of antivenom would survive. And then they'd eat all the salamanders with lower toxins. So then the salamanders, the ones that were more poisonous, would survive. So then what happened was the antivenom of the snake and then the venom of the toxins of the salamander kept increasing in this closed system, that by the time a human went in and discovered it, they were completely not adapted to the island like ecosystem that
My
we're
God.
just we're so susceptible. So it's a type of phenomenon that happens in biology. And you can observe that.
That's
And they're so
wow.
cute.
That's wild. Where do these little things live? Where do we have to watch?
I I think they're close to somewhere in Australia. That's where I can't
Like,
exactly remember where the salamander is native to, but I was in the research lab, the reptilian research lab, so I got these pictures from the lab.
wow.
So psychological flexibility is something that is being talked a lot about, and I've read some articles out of Harvard and, some of the institutions that psychological labeling as one, and that ties with, neuroplasticity, right? That's the whole thing that we're trying to train in these new or encourage in patients in these new kind of therapeutic models like psilocybin therapy, ketamine therapy. We're trying to encourage psychological flexibility to create new frontal cortex and cognitive conscious connections that are different. Like, hey, I've been repeating this pattern over and over and over again that might be leaving me in a state that's unwell. Do I have the psychological flexibility or neuroplasticity to create a different pathway and then manifest that in my life? So all of these therapies, I think, are helping support and bolster. And I would love to hear your opinion on it, Destiny. Like psychological flexibility is something we want to encourage. It helps. I just pulled this from an article, not for the article itself, but the definition. So psychological flexibility is defined as being in contact with the present moment, fully aware of emotions, sensation, thoughts, welcoming them, including the undesired ones, and moving in a pattern of behavior in the service of chosen values. In simpler words, this means accepting our own thoughts and emotions and acting on long-term values rather than short-term impulses, thoughts, and feelings that are often linked to experiential avoidance in a way to control unwanted inner events.
Yeah, I think this is everything we do in acceptance and commitment therapy, is we're building psychological flexibility. But again, this is not like a you singular job. This is in order to become psychologically flexible, we need tools and community and models for how
Yeah.
we get there. So I think that's like in the literature, I feel like that's the piece that's always missing is
Yes.
how we get there.
How we get there, yeah. And we can even reflect on our own lives. Like the moments that I've had to be psychologically flexible is riddled with fear and programmings from my childhood and things. And I'm like, I want to do something different. Like, for example, let's talk about the fact that I became a professional musician. That was completely not within what was acceptable. That's completely sometimes in society, not even if I went into a STEM field, why would I engage with an art field that makes me no money and the da 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 da. And people even have judgments on the lifestyle of an artist. Like my own family have been said things like, "Oh, well, you're just gonna be like drinking and smoking more and around like hooligans and like not in this proper da 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 da." I had to unpack so many things to be able to be psychologically flexible to do that. I couldn't have done that without my therapist. The being I give a lot of gratitude to being even in a medical field because I'm surrounded by healers, so I get to engage with them with the privilege that other people in society don't get to. And my own self-awareness and my own art allows me to be more psychologically flexible. So you're absolutely right. There's this written literature kind of concept, but the actual doing is then very individualistic. And what tools will help someone get there, is up to the individual to decide like this worked for me and this didn't. I think we've lost a lot of the patient focused practice in medicine, which is I I make my assessments, based on the patient themselves. like how they're presenting, but I tend to trust my patients because at the end of the day, they have to be their own doctor. They have to go home and be the one that takes the medicine. They have to be the one that goes home and takes this journey. And so I don't really understand in some of the conventional medical thought processes that kind of strip the patient's autonomy away, because at the end of the day, even if you do the surgery, you do the thing, the patient has to go home and do everything on their own after that. And so I don't see the benefits of excluding the patient from the process. I think that like you can prescribe a protocol that has a 99%, a 95 to 100% like efficacy, and you hand it to the patient. How the patient is feeling and how they're doing will alter the percentage of the efficacy of that treatment. So like even if you think about it on that objective level, there's a there's a filter between you as the doctor or the clinician and then the patient. And that's the patient themselves. So you always have to keep that in mind. Unless you're strapping them down and locking them down and injecting them while they're strapped down. And even that will provide some possible rejection and placebo type, alterations to your treatment. Like, and I think that that's where we're getting to because we want the patient, like, we have an interesting movement towards removing the patient from the picture. And that looks, I think that's manifesting in very unhealthy ways in our system. And I will have a full on debate with anybody who disagrees with me.
No, it's true. I think we need our guidance from our doctors. It can't just be like a very what we need that structure, but
Yeah.
we also need to be able to have a say or to be able to say, I can't do this thing that you're saying because of this. And for your doctor to not be like, well, you're non-compliant. I don't want to see you anymore, which has happened to my clients.
Yes. And
Um,
it happens yes, yes. Which then brings up ego and it brings up our oaths as clinicians. Is it just, well, I can't help you with it? Or it's like, let me help you find someone. Like I was taught on when you practice ethically, if you cannot help the patient, you don't just say goodbye. You point them, the ethical practice is pointing them to the right direction. And if
right.
that means, and sure, it can work one way or the other. Like you could be an MD and be like, I don't believe in naturopathic doctors, but it sounds like you'd work better with someone who's integrative or a functional
Yeah.
doctor or a functional MD who maybe works in a team with, like, point them in that direction. That happens to me, where I'm working with a patient, and I'm like, "It sounds like you actually just need someone who really is," and I have those names, that works specifically with antibiotics because you feel most safe in that.
Yep. Yep.
You come from a background that you will be too stressed out taking herbs that don't have the 15 years of research behind it. Like, go to this doctor, if I can't do that for you, because I did prescribe in Vermont, then we're gonna send you to an ID doc, you know what I mean? And, like, there's no ego in that. Like, I can't help everybody, you know what I mean? But I
Mm.
should be able to help point someone in the right direction, and if I think clinicians are taking an oath that we should be following that ethical practice of always supporting our patients, whether or not they agree with what we're doing, point them in the direction of someone who will be able to support that, at least keep them in a safe direction, you know?
Yeah.
So these are just affirmations and questions I have that kind of culminate all the experiences on the mind body level. So these are just phrases. I'm going to just read them out loud because I think they're very powerful. You are not a statistic. Statistics can be useful tools in tailoring your treatments. However, you are actually a beautiful and unique creature encompassing cellular tissue body, so the physical body, an ocean of emotions, and an ethereal spirit. I wish for your treatment and support to encompass all that you are. And that's the level that I work at. You have to look at someone's specific biochemistry, their specific cellular type, their specific lifestyle. But then we have to look at their emotions and to know that it is an ocean of thoughts and movements and history. And also the spirit. I was trained as a naturopathic medicine, so there's a little bit more room to think about someone's spiritual vitality. I've also come from a traditional East Asian medical background. So, in the West, we separate them out and we make it taboo to talk about. But in the East Asian medical models, they are already interwoven in. So it's not like weird to talk about, like, oh, I was angry. So my inflammation increased. So like in Chinese, I would say, you got angry. And so you like turn to your coping foods that are high in fats. And then picked up a lot more inflammation in your body, and that's why you're manifesting as like canker sores and your joints are in pain. Like I'm using Western language now to talk about something that we would say in a couple phrases in Chinese, and people and everyone would be like, yes, 上火. We became inflamed because of our emotions and then our adaptations to the emotions, and also the weather, the drying out, the blah 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 blah. That creates a environment for inflammation. It's all interwoven. So these are things that I want to share with, like, as an American, I want to share that side of myself and just be like, no, there are a lot of societies that have who understand simply logically that these things are interconnected and that it doesn't serve us to always chop them up into segments and separate them out. So go to church for the spiritual kind of side, or go to temple for the spiritual side. Go to your therapist for the emotional side, and then go to your like scientists and labs and your doctors for the body side. Like, there is in your cell a culmination of everything together.
I think, it's interesting because I always use this example, like, we do have this understanding when a 50-year-old man has a heart attack, they're like, "Oh, you're stressed. Like, you need to eat less red meat and reduce your stress." That's like
Yeah.
what you're told when you have a heart attack, and so we kind of know this, but then
Yeah.
all of our practices just, like, they don't, foster what you're
You
saying.
don't foster exactly.
Even with
Exactly.
arthritis, like, a doctor will say, "Oh, yeah, we understand, like, when it's raining out, like, your joints will hurt more." Like, an MD will say that, but yet
Yeah.
there is still no support around it.
Right. Like, what do
That's
you do
sad.
about that? What does that mean? So what does that mean to altering like the environment within your body so you maybe are less impacted by the barometric changes and all these things, right? And you're absolutely right. We tell a 50-something-year-old man who's had a heart attack, like, reduce your stress. But we're not fostering and unpacking, like, okay, this man was raised as a man to provide. And so, like, the archetype of being the male provider, swallowing your emotions and being emotionally stoic, and that you can't appear weak, we're not having those conversations. Like, hopefully, and then encouraging a man to go to therapy, like, that has its own
Yeah.
stigmas, and it's like, how do we create an environment where men don't feel weak by going to, like, work on these things that actually the divine masculine, a strong man comes from a man who's able to be vulnerable with their own emotions. Like, why isn't that the type of languaging we're putting out there? And then you'll work with doctors and clinicians who are men themselves who haven't unpacked that themselves, so they can't go there themselves.
Yeah.
So it has to start on the clinician's level as well.
Yeah.
Yeah.
Yeah, and
So
I just wanted to add to that, uh oh, I just lost it.
that's yeah.
Um, I lost it. That's okay.
It'll come back. It'll come back. It'll come back as we're talking. So, like, it's gonna come back. As soon as it comes back, to be like, hey, it came back. So this next one is about time. Our relationship with time has always comes up, and I always bring this up with my patients, right? Time, the amount of time I've lost, the time I've been in this chronic illness, et cetera, et cetera. Time in recovery. So I'm gonna just read this out loud. Healing takes time. Time invested by your provider in you to uncover, discover, and hold the pieces in your healing journey. It takes time for your tissues to regenerate, for your mind to wash away the stagnancy, dirt, and trauma from the suffering of chronic illness. It took time to acquire the illness. You watched as it changed your life, so it will take time to regain hope and witness your life returning to balance. Change and growth takes time, and this often can't be rushed. In this brings up the cultural kind of piece of the Western culture of like fix pill, fast go, consume, make. And that's beautiful. It's created this very, some benefits in this world and the tools that we have. However, we have to be careful when it comes to our own illnesses and recovering from chronic illness. We can still be in the mechanism of fast. Like, "Hey, I've been taking this medicine for a month now. Like, why isn't it changing?" And then I'm over here like, "Well, you did report this reducing and you did but your intention and your mental focus is on being done."
That's
And that's
so
a
important.
cultural value. Like as an anthropology major, and that's why I put my educational background, because I you probably can feel I take on an anthropological lens a lot in my treatment, because we have to unpack some of these values that might be making us sick. And I always see it too. When patients start getting better, they start rushing back to their old lives, and then they start yo-yoing in their treatments. You know what I mean? Like, well, I'm getting better, but I'm like not, and it's because they haven't unpacked the pressures, the lifestyle thing, and then they want things to be rushed, and and that's rush in our medical system too, right? If I was still working in the primary care family medicine practice and not at Dr. Placeris's office now, I was starting to shorten my time with people because time is money. I got to keep my doors open. I got to make a living. It's like, well, now I'm seeing people for 30 minutes, which means I have more charts, less time to read through the chart, less time to help support a patient and make sure that they leave my door feeling supported and like at peace with their like all of it. All of time is energy. Time is one of our greatest commodities, and that's what we're trying to monetize and also rush through. And so we have to think about sometimes our relationship with time and as it pertains to every aspect of our treatment, our investment into our treatment, our 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 journey through treatment, all of it. So I
I
always think that up.
honestly, I feel like we could stay here in this one part if time allowed.
Yeah.
Because it's so it's
Literally, we're having this like,
like
"Oh, well, we have a certain amount of time, and I have to get back to this, and I
yeah,
have to" yeah, like,
yeah.
I'm
It's so
caught in it. We're
true.
all caught in it.
Yeah, but no, but I mean, that really is what you said was so important around, clients will be like, "It's not working," and you're like, "Wait, I've noticed X, Y, and Z improved," but there's a discrepancy between what they're thinking should be like, what life should look like if they're improved, and basically all or nothing thinking. Um, the other piece I wanted to bring up, and this was what I was thinking earlier, was that stress isn't bad. It's
Mhm.
inability to handle stress. So when we're talking about the
Correct.
50-year-old man who had the heart attack, it's like, we don't need you to even say, "Stop working," because I think, like, that's what people hear, like, "Oh, so you mean, like, I need to quit my job?" And it's like, "Nope,
Yeah,
sometimes, yes." But,
right.
no, we actually just need to figure out what it is you're missing, and this is a societal problem, so it can feel hard to pinpoint, but it usually is, like, we don't have rituals for ending our days or the end of a season or the end of
Or
something, the
grief or
beginning.
chapters of life. Yeah,
Yeah. No,
yeah.
there's no, rituals, there's no, like, conversation, I kinda think about, like, back in the day, people would gather by the fire, there were these.
Yeah,
Yeah.
community-based processing, like, coping with the stress. Exactly, that brings up, something that like, a clinical pearl wisdom that I received, was from Dr. Beth Kami, who is a well-known chiropractor up in, Vermont, but she talked about stress with me one time, and she said, "Stress is not bad." So there's, like, a coin term, I don't think it's widely accepted, but it's called eustress, which is, like, well-adapted so maladaptive stress and eustress. So eustress is just we need stress to live. If we didn't have stress, we wouldn't wake up in the morning and go like, if you didn't have the stress of hunger, you wouldn't eat. If you don't have the stress of, like, loving, you wouldn't grieve. Like, you would grief is, like, the stress of having lost the love, but, like, in order to engage with the beauty of love, you have to also accept the fact that we're gonna grieve. But it is the maladaptive stress. If we're not able to manage that stress, that's when the stress affects us, and that brings up the holistic model, right? Of we're supposed to be remaining in balance. Our coping mechanisms, our environment, the tools we have helps us deal with stress so we can move through life. And that then brings it down to qi, which is qi in Chinese medicine is qi is an energy. It's energy, but it more translates to movement. It's the ability to be flexible and move. And that's the sign of vitality. And you can see it runs a thread through psychological flexibility. When you have good mental chi and spiritual chi, it means you're able to adapt to the stresses and the changes. And that's a sign of health and vitality. So it's like woven all in there. So thank you for bringing that up, Destiny. So, more things. So, in my medical opinion, it is possible to recover and cure Lyme and tick-borne diseases. The journey there just may be bigger, more intricate, and expansive than the pathogen and what medications you take. So sequelae, so that's the damage from Lyme and tick-borne diseases. There's also just I think Lyme, when trained with Dr. Evan Knowlton, who was a physical therapist, he was talking about the concept of Lyme adjacent. When you treat Lyme or tick-borne diseases, you have to treat everything that's adjacent to it as well. And also, if you're working as a holistic doctor or a functional doctor, you should be already treating all the things that are adjacent to it to help support someone's body back to balance. One shoe does not fit all. There's a glass slipper for use. That's a echo of the whole um, individualized treatment. Your community and the community you and I are building will help you heal. You aren't meant to go through this life alone, and that includes your struggles. So that really touches on just literally what you said, gathering on the fire. Like, this is a community based thing. This is social and societal pathogens and hardships that we're going through. We're we're supposed to be all going through, so we should be working on them together. But I know that in our Western society, it's become more easy to feel fragmented and individualized. There's been a long history of kind of like we're all in our own little homes. When you're a mom, you raise the kids by yourself. When you're a single mom, like that's sometimes not a concept in other cultural values that are out there. A single mom is not a single mom because a single mom is precious and the children will be still the future. So whether you're in a more nuclear family where like the families all live together, you don't send your elderly off to all of our wonderful elderly care homes that we have and that we do on a cultural level more here. Those are all integrated into the community. The homes are all near each other. There's the community center, there's these resources, there's the farmer, there's but we've become both decentralized and centralized in a way.
There's this creator on TikTok. He's urban something. He talks a lot about like how, you know, our cities aren't walkable and like basically community has been eradicated because of the way that our zoning laws are and policies around zoning laws. And he gave such a good example. It was like imagine Costco and imagine there was one driveway through Costco. So there's like one car that can just go up and kind of get whatever they need. So it's like super convenient, super easy, super fast. They drive. But then there's a demand now. So then maybe that one parking space with inside Costco is like, okay, now we need 8 because there's more demand. And so this it keeps growing into to the point where now Costco has to completely separate because the parking lot is in the middle of Costco, so now you've got the meat department all the way over here, you've got the clothing department all the way over there, and it becomes, as you can see, like, in our cities where
Yeah.
you have to
It's
drive to the first.
fragmentation. Yeah, very fragmented. Yeah, and yeah, I think that our world has gotten so big too with the internet, suffering, you can pull I think people what I've noticed in myself and the conversations I've had with my patients, it becomes really difficult to feel like where is your place in the community? Our jobs have become very highly specialized. Maybe not so as healthcare providers, but it becomes like I'm a cog in the wheel. Like, what is my worth and role in society that I think it becomes really difficult to feel part of a community. You know what I mean? So, and then on top of that being like, well, there's so much suffering in this world. Like, how can I even work on that? You know what I mean? Who can I even really impact around me? And diversity is beautiful too, but diversity also means more bridges to that we need to work to language bridges, cultural bridges. That takes effort. It's not impossible. It's absolutely not impossible in our world, but it does take time and effort, and that's not something that we're really cultivated to understand. So, so moving on, hold space for your suffering. It's okay to feel like a victim. Giving room for self-empathy, encourage yourself to balance those feelings with joy, utilizing tools that an experienced provider can share with you. I think it becomes really difficult to experience joy during chronic illness. It's very suffering based. It's very, and some people adapt to it. Some people, some individuals, I think, either kind of go into the passive, like, well, I'm suffering, so I give up kind of energetic. And then there's the denial, like, I'm going to push through. And in both ways have to be unpacked and looked at and given empathy to and be validated in their experience and I'm not using the word victim as like you're a victim, but to really embrace your own experience, which is part of the definition of psychological flexibility, which is being able to be with the unpleasantry of what's going on too, because that's the only way we're gonna be able to sometimes like validate it, cry about it, and then also maybe have some joy and laugh about it and then move forward, and have hope in this journey. And however small they may be or feel, celebrate your victories. I always feel like a part of my job is coaching people. If someone is still going through their suffering, but their elbow pain that they've been having or their neck pain that they've been having, possibly due to Lyme and tick-borne diseases for the last 4 years, and now they can turn their head or they can carry their grandchild, celebrate that victory. Like, it is so easy to always look ahead. And I think, again, cultural value is we're taught to work. We're taught to like essentially 5-year plan, 10-year plan, 20-year plan. Some cultures don't have that because they know that you can die and you're 3 years in, and that having a 5, 10-year, 15 plan creates a lot of suffering. It helps you be very ambitious and build businesses and have long-term goals and build empires and corporations, but it's not great sometimes being present, to being, "What do I need now?" And I think we need to balance that. So celebrating your victories now is such a loving space, and it can really help people feel like the journey is they're in the journey. You're in your own story, but the journey is what's most important. You don't wanna go from birth to, like, fast forward, just fast forward through the whole tape and then get to, like, the last year of your life and be like, "Wow, I built a family. I had this. I became a ceramic specialist, and I also built a business." Like, great, but you never got to experience all the joys of learning those skills. Now you just have something on a piece of paper that's a resume, like, "Have a nice day." And then you're dead. You know what I mean? Like, that's harsh, but I'm trying to illuminate that the journey is really what the space we wanna be at, especially in the illness part, because it holds a lot of value. And I believe this is my last 2. We still got some time to go through the last 2, correct?
Yes, we actually have
Okay.
a whole other hour because if people were live, they would have had a Q&A, but yeah, we're good.
Yeah, no worries. So this is just things that I like to share as well. So my basic job as a physician is to treat you with effective therapeutics with the greatest efficiency. But what does efficiency mean? Does it mean blast the patient with antibiotics that has been shown in research for a generally specific time period to treat a disease for the general population without considering other factors? And then what about compliance? What about side effects, people's lives and family social responsibilities? Does efficiency equal fast? Or does efficiency mean we get to a sustainable space of healing from Lyme and tick-borne diseases that may not be on anyone's timeline, the one that is a nexus point between how fast you respond to treatment, tissue recovery, and ability to tolerate treatment? So that's where I orient what I'm looking towards. I'm not walking as fast as I can to just no symptoms. I'm walking to a point where a patient can tolerate the strength of the treatment, a patient can financially afford the treatment, it fits into a patient's lifestyle. Like, if you're working night shifts and then how am I gonna fit in 12 supplements? And you're like, "You know what? I'm probably gonna just end up giving up on this," and we need to have that type of discussion where I'm like, "Okay, let's just target these 2 things and take these 2 medications and move forward," you know? That's really, really important. And then I wanted to let people know that we do have the tools to heal. Sometimes with chronic illness, it can feel like this is forever. There's nothing that's ever going to help me. And as a provider, I truly feel we have the tools to heal from our human modern scientific discoveries, gifts from the plants from the earth, ancient cultural systems, and philosophies of modern medicine, love in the universe reflected in our chosen families and friends, and found within the power of our own vitality and spirit. We do have the power to heal. We merely need to learn to access it, discover which tools are right for you at what time. And that's a strong belief. Of course, there are exceptions to that, congenital disorders, things that are just that you're born with, things like that. But I do feel like, and healing has a bigger concept than just ending suffering. And we have, I think, an unhealthy attitude towards healing and living well means living long and avoiding death as much as possible. And I think that healing in a East Asian tradition is deeper. There are people who share that they healed something deep within themselves, even though they are to die. Like, we are all going to die, but healing on a karmic level, on a peace-based level, healing to a place where you can just enjoy the present and to see the life as a gift is so deep that it kind of sometimes supersedes the physical suffering. And that's maybe more so informed by my own Buddhist tradition. So take everything I say as a grain of salt, just knowing that where I'm coming from. But that type of healing is beyond the body. And I think that that can be achieved. There's so much beauty in that, especially when we are in physical suffering. And that might be a huge concept, but I wanted to share that at least with any patient who has engaged with that as well, to know that they're validated in that experience. This is a little wisdom pearl that I always say for people who are in active treatment, because I see how eager people get when you start getting energy back or experience forms of recovery that start allowing you to do activities again. Treat it like a startup company or business. Spend 60 to 80% of that energy and reinvest 20 to 40% of it back into yourself. Sleep earlier, take an Epsom salt bath, take a break. You are starting to get better. Don't rush the blossoming of the flower, or the nectar won't flow correctly, or nor will the pollinators be ready for you. I know it can be exciting. Maybe it feels like you are falling behind, but this can lead to the oscillating yo-yo effect. I just realized this outlet isn't providing me power, so I'm going to walk over to somewhere
Okay.
with the
Yeah.
right power outlet.
Yeah,
Hopefully.
please feel free. And I've seen this with my own clients as well, and my own life as well. I've been in places where I have yo-yoed because of that, and other places where I remained steady even though symptoms weren't 100% gone, and I can tell the difference in how stressed my nervous system is. So again, we're not
Right.
trying to say, like, we are saying stress is inevitable. We can handle stress with the right mindset, the right support, the right community, the right and finance is a big part of it too, especially when we're working through treatments that are out of pocket, or yeah, they can get expensive. So that's probably a whole other talk. Well, it is that I'll be doing with a financial
Yeah.
therapist later on this
Yeah.
year. Um, so as for people who are listening to this, like, understand that the finances is a big part. And we didn't talk about that because that wasn't the topic, that we do kind of have to sometimes separate it while also acknowledging that that is a part of it. So be on the
Yeah.
lookout.
And I'm more than happy to have those conversations as well, because you know, the Lyme and tick-borne disease community, I feel very protective over them because they are so easily exploited by
Yes.
medical pr- providers. I don't want to call them providers, but you get the $10,000 center of blah, blah, blah. And they're doing a lot of symptom management. But I just really, I've seen, if you can afford it, great. But there are many people who are desperate and they put themselves in financial pathology because
Mm.
of, and it really hurts me, and it actually makes me very angry. And that's why I feel very protective over the Lyme and tick-borne disease community, because I see the practitioners who are exploiting this population, and I leave it up to for the universe to, like, pass judgment on them, but it really, really angers me
Can
because
we
you don't have to break the bank to treat this condition. Truly, you don't.
Oh, yeah. I actually, if you do have the time, I would love to talk about that. And if you don't, we can maybe talk about it in another one. Do you have time today?
Yeah, we can talk. Yeah, let's talk more superficially about it, and then
Okay.
we can talk more specifics in the future for sure. I can prepare something a little bit more
Yeah.
like
Well,
what to watch out for.
yeah, that's kind my question is kind of, are there some, maybe right off the top of your head, some things that patients don't need to do that they are spending a lot of money on in an effort for a cure? Is that a way that you can you answer it in that way?
You know, I feel that it starts off with having a trained physician who is able to do the clinical assessment to understand what is going on first. Sometimes these centers and places are doing a lot. They're just big swathing tests of thousands of dollars that may or may not give us much information, and then like very expensive therapeutics that will work for a month or two, but then won't work anymore. So it creates a reliance. So when you're doing a lot of IV therapies that are just nutrient based, maybe you need that. But if you're not doing the correct antimicrobials based on a correct assessment, the pathogens are just going to come right back. And if you're not on those the IV nutrients and things like that, can become really, really expensive, and you become reliant on that.
Yeah, another thing that I hear from clients often is that is so what you just said is important. And when people are confused, it can also feel this is the rhetoric that I clients will repeat back to me is there people tell me like, yeah, well, if you didn't heal from that, then you didn't do it the right way, or this was missed or that was missed. Everyone claims to have like the thing that the other person missed. And so I think this is just so much more nuanced.
It is nuanced, and especially because we're stepping into a pathology that still has a lot of research that needs to be done and effective therapeutics that need to be developed. I would say if somebody that's a red flag. Like, it's not the red flag because it does of course, it's situation by situation, but if somebody is saying that they have the miracle cure for this, if they say that, like, you didn't do it right, even though, like, you did it, like, I think that that is a red flag. That's strip away that. Just imagine this is, like, my boyfriend or something. That's gaslighting. That's like ego
Okay.
and gaslighting,
Yeah.
right? That's like, well, it's just because you didn't do it right. Or, we did all these tests and you spent all this money and you go back and they tell you to believe in something. And sometimes I've seen it before where I've gotten records and I look back and I'm like, well, they didn't do the first thing, which is figure out exactly what's going on. And this is a toxic relationship.
That's fair. That's fair.
I've been lying to you maybe from the beginning.
Which can happen. I think it can happen with well-intentioned clinicians too. And so I
Yes.
want to share my story real quick. I I was doing supplements for a very long time in an effort to heal kind of Lyme. But this was the start of my journey, right? And at the start of our journeys, I do think there's so much going on, especially if you didn't get bit yesterday. Like you got bit a long time ago. So things have been festering. And um at the end of a year of like supplement after supplement after supplement and feeling, and I was also financially strapped. So I wasn't like able to get as much guidance I think as I needed. And by the end of that year is when then started learning that people were doing things like IV therapies and hyperbaric chambers. And I was following these influencers on Instagram who were like doing everything. And it's
Yeah.
so expensive. And I remember at that point saying, if that is the case, like if that's how you heal from Lyme disease and I have to spend like $10,000 every 3 to 6 months, if that is the only way to heal, I'm like, I will just have to die because
Yeah.
that sounds crazy, but I didn't have that kind
It's
of,
not crazy. Yeah.
and there wasn't, so it was like, that was, and ironically, it was a turn around for me around acceptance. And it's like, well, I can't do that. And so I put
Yeah.
that out of my mind. And then through not doing it and I realized like, oh, I didn't need that even. I didn't even need that. It wasn't, it was, it would have even been harmful for me financially. So I think this is where that financial piece can,
Yeah.
if you allow yourself to move into a state of acceptance. If I had made that decision, but then for the next 6 months lived in fear around dying because I couldn't afford hyperbaric chambers, that was literally like what I was in my
Mhm.
was like the hyperbaric chambers for some reason. I called places, they were like
Yeah.
$1,000 for like forget how many sessions. And I was like, okay, but then what about
Mhm.
after that? What about after that? So your finances and your ability to pay for something, I think, can sometimes also
Yeah.
guide you in the right
Of
direction.
course, it absolutely does. I these are bigger concepts, but the way our society is structured, and not saying that I know what will be right because I've spent my time in socialized medical care too, and there's some problems there. It's This is why I said in the beginning of the presentation, like, it's not your fault. Even the practitioners who have the well intentions, maybe it's not their fault either. They're just based off of their own training, doing what they know best. And that's why I'm doing the work that I'm doing is to get this information to as many people as possible so that like, as many people can hear about the International Lyme and Associated Disease Society as possible. Please, like, you know, seek practitioners in that. Like, this is how you get people through the right doors rather than just being like, "Hey, no one knows what to do next, and no one's telling me what to do next." You know what I mean? Other than this influencer who has no medical training, whose condition might be completely different than yours, whose, like, the severity of their illness might be completely different than yours, and their financial, securities or insecurities might be completely different than yours. So, it's I don't know, we're all individuals, and we're beautiful, and I just wish people, that could be embraced, you know? So,
I think the only other thing that we did not talk about is, like, testing, and, we could
yeah.
maybe leave that for a different again,
It might be it's a little bit complex, and I would like to have that information, like, up because it's a lot. I could dive into a lot about it,
yeah, yeah,
and I would like to probably have more of a presentation in terms of these are the testing, this is what I would recommend, and, these are the issues with testing, this is the test like, I would wanna give a little bit of, like, scientific basis of why too, so people really understand because it is complex. It took me some time to really understand, like, "Oh, this is why."
yeah,
Like, I had to differentiate indirect versus direct testing and what the immune system, and it has a little bit of immunology and understanding the immune system, and this is why it creates these situations, so I would wanna give some time to that because I feel like if I gave something surface level, it'd just probably be more confusing, to be
yeah,
honest.
no, that makes perfect sense. Yeah, maybe we can schedule that. Is
Yeah.
there anything else around here, like, from your slides that you wanted to share that we haven't that we wanna end on?
Nope, I think that's pretty much it. Yeah, this is my information.
Yeah,
If anybody wants to yeah, I'll leave it up on that page.
yeah,
That's it.
perfect, okay.
I'm happy
Awesome.
to, support anybody in any way, so reach out.
Okay.
I really hope that, like, all of this is public access, so,
Yes. Awesome.
yeah.
Well, I will be publishing this and, people can yeah, you can reach out here and I'll put your information in all of the captions.
Alright, well, thank you so much, Destiny, it's a pleasure.